Conflicts of interest. What can you say about conflicts of interest in government? You know, a lot of people talk about the FDA these days, a lot more than I've heard in past years. It depends on who you are and what your career involves or what business you're in. It's usually something that's just passing, well, the FDA approved it or didn't approve it. The Food and Drug Administration is theoretically supposed to be an independent organization that can independently verify, check, research, and confirm or deny or allow or not allow certain products on the market or cause markets to withdraw from that product if they appear to be dangerous. Now, you would think that the people who are hired to work in the FDA have no conflicts of interest. And a lot of people talk about how certain FDA heads or members or commissioners have interests in the pharmaceutical industry. And this is not just a conspiracy or some theory, but a fact. And many folks would counter with, well, I would like somebody to be involved in this agency who actually knows the business. The thing is, making pharmaceuticals or working for a pharmaceutical company doesn't mean that you have a balanced view on pharmaceuticals, nor drugs, or food, or anything for that matter. Many of the people who work with, say, natural products, milk, natural milk, they deal with things like the FDA, constantly telling them not to sell their foods. You can't sell your chickens, you can't sell anything, because these larger companies have lobbied Congress and lobbied these government officials and groups to only approve their products, to eliminate competition. And when you get really deep into it, you realize how bad it is. It almost sounds conspiratorial, as if the little guy is being held down so the big major agricultural businesses and Tyson Foods and these big farms can make all the profits. But that's exactly what's happening. This piece of paper I printed before I started, I wanted to give you some facts and figures because I tend to just speak my mind without giving you the actual data. Well, these are the last 10 commissioners for the FDA. Now, before I mention this, I want to mention Scott Gottlieb, who was the former FDA commissioner, had previously worked for Pfizer, and now has gone back to working as an advisor or on the board of Pfizer. This was always an issue for us in the kratom industry because in 2016, the DEA and FDA tried to ban kratom. Rather, the DEA tried to schedule it as Schedule 1, the most dangerous drugs, and the FDA was going to back it. They were asked to, study it and figure out whether or not they wanted to ban it. We raised hell. The whole kratom industry and all the users, we just flooded the, we had all of the right paperwork. We protested. We had all the different paperwork filled out that we needed, and they eventually backed off. Okay? Now, they're back at it, of course, but that's a different story. This is specifically here. I want to stick to the point. These are the past 10 FDA commissioners. Out of the past 10, only one has not gone on to work for a pharmaceutical company. These are their names and the years that they worked. So, the commissioners, the first one was Arthur Hayes from 1981 to 1983. He went on to work for EM Pharmaceuticals as a president in 1986. Frank Young was commissioner from 1984 to 1989. He went to work for Braeburn Pharmaceuticals as an executive vice president in 2013. David Kessler from 1990 to 1997, 7 years as FDA commissioner, and he has none. He was the only one in the group that didn't join the pharmaceutical industry, as far as we know. Jane Henney from 1999 to 2001 went on to work for AmerisourceBergen Corp., a member of the board in 2002. Mark McClellan, who was commissioner from 2002 to 2004, went to work for Johnson & Johnson as a member of the board in 2006. Lester Crawford, 2005 to 2005, only 1 year it says, went on to work for Bexion Pharmaceuticals, a member of the board in 2011. Andrew von Eschenbach from 2006 to 2009. He went to work for Bausch Health, a member of the board in 2018. Margaret Hamburg, 2009 to 2015. She went to work for Annie Lam Pharmaceuticals, director, 2018. Robert Califf, 2016 to 2017, he worked as a Verily advisor in 2017. Verily, I guess, was the pharmaceutical industry. And finally, Scott Gottlieb, 2017 to 2019, Pfizer, member of board. And when you have an FDA commissioner or official or anybody in that line of work who goes on to work for a pharmaceutical industry, you can only ask yourself one question. A, did they have the actual qualifications to do this? B, were they nudged to pass and approve certain drugs that weren't properly studied in order to make a few bucks? And the question is, historically, this has been shown to be true. Many drugs have been passed with very little study, definitely not enough, and then been recalled a few years later. Certain batches of drugs, sure, but entire drugs. I mean, we've all seen the lawsuit commercials back in the day of, have you been harmed by this drug? And you've got these predatory lawyers trying to get everybody to sue these companies. Well, often these are legitimate claims because many of these drugs have been known to have negative side effects, be dangerous to the people who are taking them, and be repurposed for purposes which they're not necessarily intended for. To have full disclosure here, I'm not just speaking about this as somebody who's just briefly passing by the idea. I'm writing a book about the pharmaceutical industry. I started it in about 2017 or 18. When I thought back, I realized, wow, it's been almost 3 years since I started this book, maybe over 3 years. And it's at least 15 chapters right now. I can't remember how many pages it is. Well, it's different sections. And I did a lot of research on this about the FDA, the DEA, the drug wars, all the companies that have a vested interest in keeping the people basically medicated. And during all the way from the 50s and 60s, from the very earliest drugs that they came out with for antipsychotics, things that were basically Valium came out of that era. But the originals, there were several different drugs that were originally sold as, well, we had heroin being sold as laudanum. Laudanum was heroin combined with a few other things and put in a bottle. This was given to children, okay? Heroin was given to children for their colds. Now, maybe in small doses, it wasn't even that bad, and I would imagine, people probably overstate the addictive potential if a kid's just taking it a couple times. But the idea and the point here is that we've learned since then, we've grown in our uses of medicine. We've understood that if we make a mistake, then, whoops, we need to fix the problem. But instead of that, we're hiding the problem. And today, many of the side effects of many different medicines have been hidden. They've been disguised in the literature because a lot of folks don't want those things reported. And when the people who are making the journals and the people who are making the laws about the drugs decide that this is how it's going to be, there's not a lot that the public can do to change that or to say anything about it. I mean, what power do you have as an individual against the pharmaceutical giants who basically decide what's healthy and what's right and what's not? So now we have the current issue to bring up, for example, with COVID. When people talk about the emergency use authorization or the fact that the FDA has approved or not approved one of these shots, I don't really give much credit to them, or credibility, rather, to the FDA or their decisions. I did mention to some people that, once the FDA approves it, people will be more likely to take something, but I wasn't including me within that group of people because I really have very little trust in the FDA, just like I have very little trust in the pharmaceutical industry. If you see what happened with the Sackler family and the lawsuits regarding OxyContin and the way that they were basically got off scot-free, pay a few fines, split the company up into several smaller companies and basically start over. There is such a thing as too big to fail, okay? And it's not just a concept from 2008 about the banks. There are corporations who cannot lose. And the pharmaceutical industry is one of them. They make the decisions because they make the prices. If you remember the story of Martin Shkreli, he was that Probably, as one time, he was considered the most hated man in America. And for good reason. He was probably the most cocky, pompous, arrogant little prick I've ever seen, and I'd love to see him get his teeth knocked in. He bought a drug, I believe it was Daraprim, if I'm not mistaken. That's what comes to mind. It was a drug that was used to treat HIV patients and a couple other things. This drug was then raised from $7, I believe, or $12 a dose to $750 a dose. It was raised like thousands of percent. And when he was called out on it, he said, well, that's capitalism, baby. He was even brought before Congress and courts, and he just kind of laughed there and he said, well, that's capitalism. That's what we do. We try to get the most I can for my shareholders. And that was right there the epitome. He basically spoke out the out loud, the not out loud part. The part that all the other companies know is true, that they won't admit, but that shareholders come first before public health. Think about this. If you were working in a pharmaceutical company and you came up with this miracle drug that seemed to cure cancer and fixed everyone's problems, you took that to your boss, and do you think that a company is going to sell those pills? Of course not. They don't exist. But the point being that if you look at the actual cost of medicines, it has nothing to do with the manufacturing costs. A lot of this is paid by tax money. A lot of the research that is done by the government, and then the companies are the ones that manufacture it. Many of these drugs are extremely cheap to produce. They're not priced by the cost to produce or research. They're priced by the value a person gets from them. This was admitted by the pharmaceutical companies when they're asked. They say, well, we charge by the value of the patient. So if it's a drug that'll help you from dying in a week and give you a few extra days, or a cancer medication, it can be $250,000 per treatment. There are pills that are $1,000, $5,000, $10,000 each for one pill. That can cost $1 million for a full regimen. I mean, this is, in the West, we think this is normal. In the rest of the world, these same drugs by the same companies are sold for like a tenth of the price in a lot of places. Why do we let this happen? And why do we let the pharmaceutical industry determine what we should take and what we shouldn't? I guess what's more bothersome is, why don't we have agencies that can actually legitimately protect us, the people that we pay, the people that we hire, the hired help? They are our employees. Every single member of the FDA, every single member of Congress, every single president, they are your employee, okay? Our employees. And it feels like America's forgot that. And not having our best interests at heart is nothing new for most of us. So how do we know what's even, legitimate? Like, how do we know whether we should live a certain way or eat a certain way or try to be healthier? Or, let me back up here. When it comes to being healthy, have you noticed that during this entire pandemic, you haven't heard the quote officials or scientific experts or the panels or the epidemiologists at all on the media or from the government talking about home therapies or alternative methods to protect your immune system? How often do you hear anybody in the government talk about going out into the sun, getting vitamin D, and protecting yourself through your actions and your behaviors and your attitude, rather than just getting a shot and hoping you're okay? Now, first off, I'm not opposed to vaccines. I just got my son his tetanus. Mumps and measles can be seriously damaging to kids, and I totally agree with that. They've been pretty well tested over the years. But now I have my concerns about the current one, and I'm considered to just be thrown under the bus because I doubt the FDA and because I doubt the potential for future damage that might be done to my system or my kids. Los Angeles mandated vaccines for kids 12 and older, even though they're only approved by emergency by the FDA right now for kids that young. And I think, when did government start deciding the science. I can't believe how obvious it's become that those who are the hired help are overstepping their bounds and not going along with the rest of the world, and not going with, I guess, what top scientists. There's no longer a discussion. It's just about what your scientist says. You know, it's just as bad as believing Bill Nye. I mean, you know, that guy is, you know, I think he has an engineering degree or something, but he was a perfect example. He was asked about philosophy and he said it was pointless. He knew nothing about it. He didn't understand Descartes or any of this. And I thought, he was a perfect metaphor. The science guy that says philosophy is pointless, not realizing philosophy is part of science. It's the same way that with medicine, we're ignoring the fact that we only need the medicine because our health is out of order, because we have what you might call an illness, or dis-ease. That term, we've heard this before. Disease is dis-ease. Your body is not at ease. Often when we have an illness that's really bad, we find that there are natural things that we can do and methods we can use to protect ourselves and to heal quicker. They're not being discussed at all. We've completely given up on health in this country. Nobody's talking about the literal elephant in the room either. Being overweight severely puts you at higher risk for all types of diseases. And why isn't the FDA ever talking about that? Why don't they ever focus on diet? Because it's embarrassing for people and they don't want to hurt anybody's feelings. Even when I've talked about it, I've had people call it fat shaming. Give me a break. It's just like saying drug shaming. Now, I don't agree with people doing, using drugs heavily on the streets, but hey, I'm not drug shaming them. I'm shaming them as humans for abusing their own body and abusing, I guess, society quite often, because we end up taking care of each other. We all are a brother's keeper, if you will. And I'm not immune to this. I've made mistakes. I don't eat sometimes as healthy as I should. I feel guilty if I put too much sugar in my coffee, but I try. I make an effort to try to think healthy, to try to live in a way that's, there are ups and downs, and sometimes we suffer more than other people, and therefore we have a bad moment. Maybe our immune system is down, and we you can't always win. You can't always be prepared. But anyhow, I'm just kind of rambling off topic here, but I thought it was just an important thing to discuss. The FDA is not what we think it is, what a lot of people think it is. Kind of like the DEA or the CIA importing cocaine in the 80s. If you're not familiar with the Freeway Rick Ross story, it's phenomenal. You can't trust government. You just can't. So there's nothing we can do except just live our own lives as best we can and try to not be as influenced by them. But don't feel guilty. It's the same thing I feel when people have maybe a psychotic breakdown, okay? And they tell them, take medication. Sometimes you're better off not taking the medication and getting over it on your own, and the medication can be worse. And that's something we should be able to determine for ourselves. And those are my thoughts. Peace out.